We are staying focused on heart health, particularly aortic aneurysms. Dr. Sid Pahwa is a cardiovascular and thoracic surgeon. He's an expert on this and the perfect person to fill us in. Thank you so much for coming in today.
Thank you very much for having me.
So let's start first with this diagnosis. What exactly happens with an aortic aneurysm?
So an ascending aortic aneurysm is basically an abnormal growth in the ascending aorta, which is the main blood pipe which carries blood from the heart to the rest of the body. Now, when it grows to a particular size and beyond 5 to 5.5 centimeters in size, then bad things can happen. And by bad things, I mean there could be a tear in the wall of the aorta, or it could rupture, and that could be potentially life-threatening.
So let's talk here about some of the risks. Who is most at risk, and what preventative measures should we all be taking?
So patients at risk of having an ascending aortic aneurysm are patients who have a strong family history of an aortic aneurysm, patients who have uncontrolled blood pressure or hypertension, and smokers. So if one is at risk of having an ascending aortic aneurysm, the issue is that there are not very telltale signs and symptoms of an ascending aortic aneurysm. Patients sometimes experience vague back pain or pain in between their shoulder blades, but it may not be very specific. So patients who are in the at-risk category, it's important that they get annual vascular screenings with a CT scan to make sure that they don't have an aneurysm.
Is that something that they would learn at the doctor, that they are at risk?
Yes, if they visit their primary care provider routinely, if they have these risk factors, then they learn that from them.
Okay, very good. Finally, what are the treatment options if you do get this diagnosis?
Thankfully, the treatment options are excellent. If one is diagnosed to have an ascending aortic aneurysm, surgery is a very good option. Surgery for an ascending aortic aneurysm offers complete treatment and an excellent quality of life post-surgery.
Okay, well that's a happy ending to this.
Sure.
Thank you so much for coming on, spreading awareness. Perfect with February being Heart Month. We really appreciate it.
Thank you for having me.